think we will go ahead and get started. Thank you everybody for coming today. And got a couple of speakers from the State Health Department today. And before they get started, just a plug for next week, we have B-Rad Applegate will be giving his PhD research update seminar this time next week. And then 2 weeks from today, we have Mesa Walters, who will be giving her informational seminar for the PhD program. Today, we're super happy to have Heather Zimmerman with us from the State Health Department, and also Danny Power. Real fast about Heather, and then I'll introduce Danny and then turn it back over to Heather. So Heather is an epidemiologist for the Montana Public Health and Safety Division and the Surveillance and Informatics section at the State Health Department. Her current role focuses on improving data governance and use of Montana's core surveillance system as part of the Montana data modernization efforts. She earned her Master's of Public Health and Epidemiology from St. Louis University in 2007 and has been working at SPCHS for the past 16 years across many different data systems and topics. Heather will be giving the majority of the presentation, and Danny's here to also answer specific questions that might come up related to the data. So Danny is also an epidemiologist from Montana Department of Public Health and Human Services, or State Health Department, and in the Montana Public Health and Safety Division, also in the Surveillance and Informatics section. He oversees the Montana Infectious Disease Information System, which collects and disseminates data on infectious conditions throughout the state. He earned his Master's of Public Health from the University of Montana in 2021 and started working with Montana DPHHS the same year. So special welcome to Heather and Danny. And Heather, go ahead and take it away.
Thank you. I will just share my screen. And is that still looking good?
Looks good.
Okay. So as we go through this, I'm just going to talk through the highlights of our core public health surveillance systems, what kinds of data each of them contain, and also how you can get access to that data. I'm not going to be able to see the chat, but if you have questions, go ahead and put them in the chat, and maybe Danny or Tony can just interrupt and let me know there's a question, and we can just take questions as we go through, or at the end there's probably will be time for questions too, so we can just get started. So first I'll go through vital statistics. So vital statistics refers to all of the major events of life that are legally required to be reported. So that includes death, birth, marriage, divorce, fetal death, and induced abortions in Montana. Not all of that data is available for public use, but I'll go through the big ones at least. So death data is recorded on death certificates, and it's required to be reported to us for all Montana residents' deaths and also for all deaths that occur in the state of Montana. So we have an agreement with all of the other states to exchange data for residents. So if a Montana resident happens to die outside of Montana, their data will get sent to us from the state where they died, and then vice versa. If someone who's not a resident lives or ends up dying in Montana, then we collect that data and we can send it to their state. Probably the most important data for public health purposes is cause of death, and that's certified by either the attending physician for the death, or the county coroner, or sometimes it'll be like the medical examiner for the state. And also we get location of residence at the time of death, the actual location of the death. Was it in a hospital, at their home, a nursing home, demographic information, and then a few other pieces that are public health significant is a checkbox if the person tobacco use might have contributed to their death, or if it's a female, was she pregnant at the time of her death or within 42 days of death, stuff like that. Birth data, of course, is from the birth certificate. And so this is set up very similar to death data. It's for all residents of Montana and also for births that occur in the state. It collects a lot of information about both parents, the mother and the birthing parent, or the father, whatever. Sorry, and also a lot of information about the actual birth, the location of the birth, prenatal care visits, the number of visits, when visits started, smoking and alcohol use during pregnancy, preeclampsia, gestational diabetes, all sorts of stuff. And then, of course, birth outcomes. I haven't listed even close to all of it, but you get the idea. Then fetal deaths are required to be reported only if the fetus is at least 350 grams at the time of their death, or if they don't know what the weight is, if the pregnancy was completed through at least 20 weeks of gestation. And so fetal deaths are not an encompassing of all deaths during fetal deaths during pregnancy, because anything earlier than 20 weeks or less than 350 grams isn't reported. But it does get to some measure, and it collects a lot of the same information that's on a birth certificate, but it's focused on the outcome where the baby did not make it, and as such it also has cause of death. And then for induced abortions, we only collect data on abortions that occur in Montana. We don't have the data use agreement with other states to be able to get data for abortions that might have happened outside of our state. And so that's one limitation. Also, we're not legally able to release any case level data with abortions. We can only do summary statistics that are deemed safe to not identify anybody. And then just for vital statistics, our main person that you can contact is Alireza Gar, and there's his email there. And then also I have, for all of the data systems, I'll put the main point person and then also the website. And so, like, we know people change, but the website should probably be the same kind of forever. Our next data system is the behavioral risk factor surveillance system. It is a telephone survey. It's random digit dial telephone survey that targets uninstitutionalized adults living in Montana. And currently our sample is 70% cell phone and 30% landline. The data is being collected right now. It's collected continuously since the early 80s, actually. And the great thing about BRFSS is that, actually, I should go to the strengths and limitations. It's a survey, so it is all self-report data, but it's a national system that is standardized across all of the states with core questions that are asked everywhere. And then also it's a state-based survey so that we can add our unique Montana questions that we need to get things that maybe aren't on the core questionnaire. So that's really one of the biggest strengths of BRFSS, is that all of this data collection infrastructure is supported, and people, public health programs, can add, just one or two questions and not have to field the whole survey. So that's pretty exciting. And then, of course, the limitations. I already mentioned the self-report data. And also, we don't collect enough sample to be able to do smaller than state level estimates most of the time. We do have a geographic strata that looks at samples by region, so groupings of counties. And as long as we have 500 respondents in each of those regions, we can get direct estimates for that. But most counties will never get 500 respondents. So that is another limitation of the data. And sort of to address that data, BRFSS worked with some other programs at CDC to come up with a small area estimation program. It's called CDC Places. It currently does not have any staff. The CDC Places staff at CDC were all let go at the beginning of this year. But there has been a lot of talk in the public health circles on if somebody could take over that methodology and keep updating those estimates. But the data through 2023 are still available at this website. And if anyone wants to look into small area estimation for Montana, we would love to hear about it. And then our main BRFIS contact is Lauren White. And we also have this general BRFSS web email address, so that's monitored by a couple of different people. And then the national BRFSS website is really a great resource. You can get public use data sets that include the core questionnaire that's asked across all the states for Montana or for every state, and do your analysis really easily from the CDC website. So that's nice. Next, we'll talk about the Montana Central Tumor Registry. So cancer is a reportable condition in Montana and also across the whole country. So similar to the communicable disease data that Danny works with, every time a case of cancer is diagnosed or treated in the state of Montana, healthcare providers are required to report it to the tumor registry. And then we also have data exchange agreements if a person gets their cancer treatment outside of Montana, but they're a Montana resident. So it's very complete. We've been collecting data since 1979 and have had consistently very high data quality in Montana and really across the whole country. The cancer surveillance system in the United States and in Canada too are very standardized, and they work really well with each other. So it collects data on demographics of the patient, treatment information, obviously a bunch of information about the actual cancer, the cancer site, the type, the histology, the grade, all sorts of stuff, stage of diagnosis. I think there's 5 different staging modalities, I guess. I don't remember what they're all called, but if you work in cancer research, you know there's not just one way to stage a cancer. We collect all of them. It's easily compared between states and at the national level. And it is very complete and not duplicated because we do have information on identities of people, and we track patients through time to collect outcomes of the cancer diagnosis too. Our main tumor registry contact is Ty McCaffrey, and I put the website for the Montana Tumor Registry, and then also for cancer statistics at state and national level. This United States Cancer Statistics website is also a great resource. Hospital and emergency department data. So we get hospital surveillance data from a couple different sources. The first one is from the Montana Hospital Association. That's what MHA at the top of the slide stands for. MHA gives us de-identified data from the uniform billing form for every emergency department encounter and inpatient admission from participating hospitals. So if a hospital is not a member of MHA or they decide that they don't want to include their data, then their data won't be included. We do have a pretty complete count. I think it's something like 90% of inpatient admissions are covered with the data we get from MHA, but it is not everything. Most notably, it does not include hospitalizations from the Veterans Administration Hospital here in Helena, and also not from the Montana State Hospital, Warm Springs. So if you're interested in behavioral health, admissions, that is missing, and also not from any IHS facilities. The data that's included is everything that's on the billing form besides identifiers. So age, sex, race. We do note that there's a lot of missing data for race on the billing form. Length of stay, date of admission, primary diagnosis, up to 8 secondary diagnoses, procedure codes, total charges, primary payer, all sorts of really good information. But like I said, it is de-identified, so we have to count admissions and we can't count people. We don't know if the same person is being admitted multiple times throughout the year, or if that person is admitted in one facility and then transferred to another facility. We have to count each of those admissions separately because there's no way to link the two together. Another way that we get hospital surveillance is from syndromic surveillance. So syndromic surveillance was set up in the early 2000s as a response to bioterrorism threats, actually, and it's intended to be like the fastest um, way to sort of monitor what's happening in emergency departments. So it's near real-time data feed from emergency departments to Essence, the system that CDC uses and that Montana is a part of. And the data includes, it is de-identified, so it's the same thing where it's counts of visits, not people. But you can search by diagnosis code or you can search by chief complaint. And through the past 25 years or so that syndromic surveillance has been a part of public health surveillance in the United States, CDC has developed many, many different syndromes that can search through the text fields of chief complaint and also the visit notes and the diagnosis codes, and all of that has been developed and validated by CDC, and it's a really powerful source. We use it a lot for just monitoring things like respiratory illnesses during flu season, or um, if there's an outbreak, we can use it for case finding because it gets down to enough detail that we can look for the specific symptoms and then contact that facility and say we think these people might be part of this outbreak. Um, it's really very powerful. And then our hospital data contact is Vanessa Wadham. We also have another one of those generic email addresses for this that is monitored by many other people. And this first website is for the Montana hospital discharge data from Montana Hospital Association, and the second one is for syndromic surveillance. Next, we have MIDAS, our Montana Infectious Disease Information System. And MIDAS is the data system that we use to collect data on all reportable conditions in Montana. So the list of reportable conditions is updated pretty regularly. It doesn't usually change a lot, but the best way to know what is reportable is to go to the administrative rules of Montana. And I have a link here of the rule that dictates what conditions are reportable in Montana. And again, this is among people that are treated or diagnosed in Montana or among Montana residents. So we do get data from other states if a Montana resident is diagnosed outside of state with a reportable condition. We collect patient demographics, diagnosis and treatment information, county or jurisdiction of residents, and then each different condition has some specific information that's required. Like, for example, if it were a case of plague, there's information about possible exposure to like rodents or I don't know, travel history, stuff like that. But we wouldn't necessarily report or collect that information for a case of whooping cough, for example, because it having rodent contact doesn't matter as much for whooping cough. So that's what I mean by the condition specific information. And our MIDAS contact is Danny, who's on the call today. And then we can go forward with getting the data. And so I kind of sped through each of the data sources because I wanted to spend a lot of time on how you can actually get to it, because I thought that might be a little bit more interesting for you. But I'm going to pause and see if there's any questions in the chat, or if someone wants to just shout out a question, that's fine too. Okay, well then let's just move forward. So a lot of these data are part of a national system, and so you can get data for Montana specifically, and also nationwide estimates on these websites. CDC Wonder, I will actually show you live because we're going to have enough time to look at it, and this U.S. Cancer Statistics Public Use Data is the website that you can see cancer surveillance data and actually apply for access to the line level data if you want to do that for your research. Or there's this data visualization tool, which is sort of like a more user-friendly summary statistics that are curated by CDC and put together. Again, I have the BRFSS website. You can get prevalence and trends data, which is again the actual statistics, or you can get line level data. And then this national notifiable diseases data, that's related to communicable disease, so all of the reportable conditions. And I'm gonna end the slideshow and switch my sharing so that I can show you the website. All right. So here is the CDC Wonder homepage, and you can pick from a bunch of different data sets. There's birth, cancer statistics, or all of these different deaths ones. I think probably the most useful general use query is this underlying cause of death. So I'll just click into that so you can get a chance of what it looks like. All the queries kind of look the same, but they're all a little bit different too. So let's go into the underlying cause of death. You have to agree to the terms and conditions. So make sure you actually read those the first time. And then this is what the query kind of looks like. You can first pick how you want to organize your table layout and do group by. It defaults to the census region. I usually change it to year or sex or something like that. And then you can pick which statistics you want. We'll just click age adjusted rates and get confidence intervals with that. Or you can do percent of deaths, or you can just get counts. And then on this selection, there's the states, but you can also pick census regions. You can also pick these other geographies. I've really never done any of them besides states. But then the other thing I want to point out is that it's not only states, because you see this little plus sign next to the code. If you hit open, then you can see all of the counties within Montana. So you could actually pick a grouping of counties. The data will be automatically suppressed if there's less than 16 events for whatever you're searching for. So there'll be a lot of suppression, especially with an individual county. But if you want total deaths or something like that, that's very doable at the county level. So I'll just stick to all of Montana. But you can also just do like control and select multiple counties too. You don't have to do just one county. And then you can pick demographics. All of that is sort of the same thing where you can pick multiple things, either one level or hit control, click to click a bunch of things. You can pick your date range. And then for underlying cause of death, you have the option of just picking individual ICD-10 codes. And again, you see these little pluses here where you can open up this whole grouping and see all of the detail in there. And now you've got these subcategories that you could then open more. If you have specific diagnosis codes, you can do that. Or probably the more user-friendly thing is to go to these cause lists. So this 113 cause list is based on groupings that the National Center for Health Statistics has put together as the rankable causes of death. So every time somebody is talking about what the leading causes of death are, it's based on these rules where tuberculosis can be a cause. It's got this pound sign next to it. So it is a rankable cause by itself. And you can look at just tuberculosis, or you can look at respiratory tuberculosis versus other, but together, those two together is what's rankable. So I'm just trying to like show you what the nomenclature means, because it's all kind of daunting. I'm going to pick a cause of death that's a big one so we won't have data suppression. So I'll just do cancer, the malignant neoplasms there. And then once you've made all your selections, you can fiddle with these options. And then this send button is kind of throughout. You don't have to scroll all the way to the bottom. And you can get your analysis. So usually it's a little bit faster than this, but right. Let me look and see if there's any. I was going to see if I could see any comments before. Yes, we do track measles. It's a reportable condition. Actually, there's a measles dashboard that gets updated weekly since the outbreak started this year. Danny can tell you a lot more about that. Yes, many zoonotic conditions are reportable. Yep, I see Danny's. Okay. So anyway, this is what the results look like. And then if you get to this page and you see there's a bunch of suppression and it's not really what you want, you can always go back to the request form and change things. So that's CDC Wonder. This is a dashboard that we put together specifically for local health departments, but I think it could also be useful to lots of other people, and it's all at the county level. So you choose a county here. I'll just choose Missoula County since a lot of you are in Missoula. And then this introduction summary is all about Missoula County, and the demographics do update according to the data, that most recent data that's in there. And then we have on each of these tabs, we have data from lots of different data sources. The demographics and the population are all from census. They're from American Community Survey data. Under social determinants of health, we have some things from American Community Survey, some things from BRFSS, some things from the Small Area Estimate Program, CDC Places. Chronic conditions has the most common causes of death for chronic conditions, and also the most common chronic disease hospitalizations, conditions that lead to inpatient stays. So I won't go through the whole thing because I think it's pretty intuitive. You can do count or you can do rate and switch for in the county and also for Montana as a whole for comparison. So we put this together specifically for local health departments to try to put together the things that they would need most often for like a community health assessment, that kind of thing. But I think, like I said, I think it can be useful for lots of other programs or people in the state. So I just wanted to show you that one. And then we have the US Cancer Statistics data visualization tool, which is also a pretty cool tool if you're interested in cancer research at all. It looks a little different than the last time I looked at it, but yeah, you can do incidence, mortality, survival, which is really interesting, and then also prevalence of cancer across the United States. Some of the special topics areas are pretty interesting. I like that they also include early detection and risk factors. So these cancer screening and physical activity, all this stuff is actually coming from the behavioral risk factor surveillance system data. And I think that's really cool. And then they also let you compare between geographies and also by cancer site. So that's pretty cool. Let's see. Last thing I was going to show you is our data request tool. So if I'm going to stop sharing the website and then we'll go back to the presentation for just a minute. Okay, so we went through the public data sources and then directly from DPHHS. I already showed you the Community Health Insights dashboard, but here's the link in the slides, which I shared as a PDF. So you all will have these links in the future. We also do a lot of static reports. We're trying to get away from those a little bit and have a little bit more interactive stuff, but we still produce a vital statistics annual report, a tumor registry annual report, and an animal annual communicable disease report. So all of these link to the most current version of that. And then finally, you can always make a data request. And so this link goes to the form that I was about to show you before I switched back here. Now I will go back again. I should have thought this through a little bit better. So when you click that link, you'll get this, and I'm going to click state login because I'm a state employee, and it'll get confused if I try to log into the citizen login. But anyone who doesn't work for the state needs to do citizen login, and you have to use a state of Montana Okta account to log in. But it's super easy to use and to get. And this is what the form looks like once it gets through all of the sign in. Oh, right, we'll just do that again. It'll work this time. There we go. And so the form looks like this. And if you can't find what you're looking for, always feel free to make a data request because that's a big part of our job. And you can pick under request type, you can pick, if you want to try to get case level data, you can pick this data pull option, and there'll probably be a lot more paperwork to do besides just this form, but it's an option. Or if you just want to try to get some summary statistics, you can do data analysis. And then down here under category, if you do anything besides Medicaid, because Medicaid doesn't do public data requests, but any of these vital statistics, hospital discharge, BRFSS, MIDAS, all of that stuff, all of these options, you'll get directed to someone who works for the state health department, who is uniquely able to answer your question probably. So if it's a healthcare associated infection that you're interested in, then you can pull up and look at, oh, I want surgical site infections, or I don't know. And then there's these text fields where you can just type in what you actually want. So it's pretty handy. And I got through that a little bit faster than I thought I would. Does anyone have more questions that I can answer or that Danny can answer?
I'll hop in, Heather, with a quick question. Is there, for these data visualization tools, is there a training provided for folks on how to, or maybe to not interpret some of the data? Is that something that folks come across?
No, I mean, not really. But I think at least for the US cancer statistics, there used to be at the top, there used to be like a little paragraph that they would update with the data, and it was putting the data in a sentence to try to help people get to the right conclusion. But it looks like that's not there anymore. So, well, here actually, if I click on Montana, it'll show you in Montana so that's sort of the best that there is, really.
Yeah.
But at least for the things that we have put together, we try to make it, I don't know, as easy as possible with the labels. But I'm not aware of any training that's specifically related to that. That would be a good thing to do.
Thanks, I appreciate it. That sentence is even, is helpful to make sure people are aware of. Cool, thanks.
And at least for all of the data systems that we maintain here at the state, I know that when I get a data request, I always type out that sentence for whatever the data request is, because I don't always know what the data literacy is of the person asking. So I think a lot of the EPIs do the same thing here.
Heather, I had a question for you about one thing that you said in the beginning of the presentation, talking about the small area estimations. Can you talk a little bit more about that? And you said that you're looking for folks to work on projects related to that.
Yeah, here. Actually, I do. Yeah, so this places data, it's using a a probability model with both the BRFSS data at the state level as well as census data to try to come up with an estimate at the county or the city level for all of the things that we collect from the survey. And right now, that data is only current through 2023. And we just got the 2024 BRFSS data. So it's not like super far behind, but like I said, nobody at CDC is going to be updating this because all of those people lost their job at the beginning of the year. But everyone who works in BRFSS across the whole country is interested in trying to see if there's somebody who would be able to sort of take that up, mine the methodology and try to keep it going. So that's all I was really talking about. They haven't released, CDC hasn't released the very specific methodology that you would need to actually do it, but there is these overviews of kind of like what it is and how it's doing stuff available on the website. So that's that basically. But it would be kind of a cool like project to work on making a Montana small area estimate kind of thing.
Yeah, thank you.
Yep.
I'll throw in like one more thing. I know the like Montana Infectious Disease Information System can be a little bit of a misnomer because we do have some things that are non-infectious. So like for anybody interested in environmental health, we track like cases of lead poisoning, mercury poisoning, cadmium poisoning, arsenic poisoning. So we do have like some other things in there specifically related to environmental exposures, and we can like produce that data as well. But yeah, the data in Midas, we started using this system back in like 2011. So we have like quite a good amount of data in there. And yeah, we have like all 59 either like county or tribal public health authorities have access into Midas and are like putting information in there as they're following up with diseases. So there's quite a lot that goes into it.
Yeah. So Gilbert, I see your question. What is the biggest data need in Montana right now from your perspective? And I will say that's a hard question to answer. The first thing that comes to my mind is having identified hospital data would be great if we could deduplicate admissions and ED data. I don't really see that happening anytime soon, but that would be a real game changer, especially for chronic disease surveillance. Do you have an answer for that, Danny?
I think there's like a piece of it that it's gotten better. I think the COVID pandemic improved it a lot. Was like this linking up of more rural communities through data. But COVID really incentivized a lot of our facilities to onboard in descending data. But there's still like some gaps in some communities where there's like just not the funding or not the skill maybe. Like we have one hospital in the state that still uses paper records. So like we can't get them into this state of, everything being electronic and then meshing them into all these other data flows because everything's on paper. So I think that kind of part of it is like this data modernization of health records and like the ability to send them across, or sometimes it's the way like our bigger hospitals, healthcare organizations like Billings Clinic or Logan Health, they have the resources to do these sorts of data projects with us and onboard into like the most recent technologies that are sending like the best data. But then we have a lot of facilities that are, their EHR system, the contract they signed is very constrictive, and for them to do this work, they'd have to pay on top of their already existing contract, and they don't have the money for it. Some of which we've tried to address DPHHS by offering like some one-time grants to these facilities, and it's worked for a couple. But obviously, like with the way that federal funding is right now, we don't have the funding to like continue that initiative. So there are like some gaps within the state where the data is not as good as we would hope. But
Yeah. Any other questions?
So do you guys share data with like Logan Health and Billings Clinic and Providence? Or do they share data with you?
So anyone that reports data to the syndromic surveillance system is able to see their own data in the system and do analysis like that. Other than that, I don't really think that we give data to healthcare facilities unless it's about their specific patient, because it's all dictated by the HIPAA rules. So it would be everything has to be limited within their patients, basically.
yeah, there's been some work both at like the state and then more also at like the local level of trying to, if local public health notices through syndromic surveillance that they're seeing an increase of something, they might reach out to the local hospitals and ask them to keep an eye on whatever it is they're looking at, that sort of thing. So there's like some data sharing that goes on with that. I think maybe like rounding that in with Gilbert's question as well is like the getting more cooperation with the like our health information exchange in Montana and like trying to make data more available through that, because that's kind of that piece of like sharing data with us and then sharing data back to those hospitals. And we've been working with them this year trying to get like some more agreements in place for data use.
Okay, any other questions for Danny and Heather? Okay, that was really interesting. You guys do a lot of cool stuff. Thanks for sharing all that.
Yeah, you're certainly welcome. I think a lot of people don't realize the breadth of public health surveillance, so I'm happy to share.
All right. Well, thank you both.
Thank you.
All right.
Thank
Take
you.
care. Bye-bye.